Some researchers are canvassing an increase in the price of tobacco cigarettes in Nigeria by 50% to avert 23,838 deaths and 602,325 disability-adjusted life years (DALYs) from smoking attributable diseases in 10 years. The stakeholders gave their separate submissions during a report dissemination workshop on illicit tobacco trade in Nigeria, held at International Conference Center, University of Ibadan. News Agency of Nigeria reports that the workshop was organized by the Center for Study of Economies of Africa, CSEA. Dr. Adedeji Adeniran, a senior research fellow at CSEA, called on the government to think more around tobacco taxation and other tobacco control policies to reduce its burden and havoc.
In Nigeria, on a per annum basis, we spend around, in terms of cost, around more than 500 billion naira on tobacco attributable diseases. And if you look at what are we benefiting, I mean, it's not in any way going to approach that. I mean, this exercise we are doing today in Ibadan, we are trying to talk directly to the public, and we are also trying to talk directly to the government about what they cost. And from there, we think we would have much more engagement in terms of targeted meetings with stakeholders. As an organization, we are already part of the National Tobacco Control Alliance.
Dr. Iraoya Augustine, a research associate from CSEA, who said illicit tobacco trade was rampant in Nigeria, recommended increase in taxes as the most effective mechanism to address it.
Illicit trade is rampant in Nigeria, especially in terms of tobacco trade, and we discovered that one of the most effective mechanisms of addressing this illicit tobacco trade, according to the World Bank, World Health Organization framework, is to increase taxes. Presently, Nigeria is using a tax rate which is far below the recommended rate of 75%. Then I talk about increasing it to 50% or even at 75%. We discover that the issues, the economic burden and the health burden of illicit tobacco trade and smoking in Nigeria will be greatly reduced.
And in his remarks, Dr. Adeniyi Olabumuyi of University of Ibadan stressed the need for improved data gathering and recording system in the country.
I think the economic impact in terms of what the economy has to pay is underestimated. The government, a sensible government, should tax those products so that they can save some out of that tax that will now be involved in having to manage the issues, the health-related issues that come from indulging in such.